So my first question is regarding the food habits. People who are suffering from the diabetes, means what is your suggestion about the food habits if they want to smoke or they want to take alcohol? What is your suggestion about that?
Well, for the diabetics, if they are traveling, I will be taking your questions in three parts. One, what should they eat when while they are traveling? Number two, whether they should smoke. Number three, whether they should drink. For the first part, our idea is very clear for all the diabetics that they should be taking low sugar, low fat, diabetic diet, and they should be taking the diet that is high in fiber. It is a myth that they should not be taking this and they should be forbidden from altogether from taking that. It is not that. They should keep their calorie counts. They should keep low calorie diet, 1400 to 1600 calories. They should keep a low carb in the sense they should not be taking too much of sweets. They should avoid ice creams while they are traveling, avoid direct sweets. But otherwise, they can take everything they like. They can take rice, they can take chapatis, they can take all. For example, if they want to take bread, they should try to take whole wheat bread. For the breakfast, they can take oat brains, any cereal that is much poha chilwa, what we call, that is much better. Second question, whether they should smoke. For that matter, why diabetes? Nobody should smoke because smoking is most injurious. It causes cancer, it causes so on and so forth. So it is big no. Regarding alcohol, yes, all the diabetics are allowed to take alcohol in mild amount, that is at least 45 ml twice a week or once a week. That is sufficient and they are not forbidden from that.
Okay. So my second question is that diabetic patients are generally weak and they after taking insulin, they usually get the weight. What is your reaction about that? There is a change in the body weight.
Again, if you ask me why the diabetics are losing weight, one is their sugar is primarily uncontrolled. Because of the uncontrolled sugar, they are losing weight. Once we initiate on insulin and their sugar become tightly controlled, then they gain back the weight that they have lost. That is one. Number two, insulin per se increases the weight. So once we put a patient on insulin, that is very important that they should exercise more to counterbalance. As such, all the studies says that people tend to gain about 3 to 4 kgs. That one can shed by going for excessive exercise.
Okay. So there is a research report who says that people lose their fertility if they are suffering from diabetes. What is your opinion regarding that?
You see that I will want to correct you that this research report says erectile dysfunction, not fertility. There occurred no decrease in spermatogenesis for male and there occurred no decrease in ovulation for female. So that is fertility part. So diabetes does not make you infertile, does not decrease the chance of fertility. But erectile dysfunction, yes. A prolonged diabetes may have erectile dysfunction from multiple reasons. One is psychogenic, of course. Number two, because atherosclerosis, that is deposition of cholesterol, occurs generalized. So there may occur blockage in the artery that supplies the genital organ. That can cause erectile dysfunction. For that, they have to consult the doctor and get the treatment, and that is correctable.
Okay. So my next question is change in the lifestyle. Do you believe this is the only factor which creates the diabetic, or do you feel something else which are responsible for increasing the case of the diabetic in India?
Well, you have touched a question that will require hours to answer. One is genetic preponderance. We Indians are genetically, I will say, much more susceptible to diabetics. Number two, we have been a famine-stricken country initially, and genetic mutation does not occur overnight. It takes hundreds of years for a mutation to occur and give rise to some disease phenomenon. So you cannot say that genetics has changed overnight and in 30 years or 40 years. You cannot say. Number two, the lifestyle has changed. And what has happened? India was basically a famine country, and suddenly we started getting more food. We started eating more food and we started exercising less.
Yes.
So this has increased. This has caused increase in the diabetes. Number three is sedentary lifestyle. Most of us Indians have lost habit of exercising. We do not exercise. Fourth, as I always say, we Indians tend to eat carbohydrate with carbohydrate.
Yes.
We take roti with aloo.
Yeah.
Chawal along with this, we eat carbs with carbs. We do not, our diet is more of carbohydrate, so we are more susceptible to diabetes. So these are three four things, and there are multiple other reasons that causes increase in the diabetes. But the main thing, if you ask me, for us Indians is lack lifestyle is sedentary lifestyle, high carbohydrate diet. So if we try to cut down on both, we will be able to combat diabetes more efficiently.
Okay. Sir, are you satisfied with the awareness campaign which is conducted by the government or the NGOs or the private hospitals?
No, I am not satisfied. I feel we should go more aggressively by the media as such. There should be on television there should be programs more where the diabetics is discussed, and people are told that diabetes is not a some disease where they should feel taboo about, they should feel ashamed about, and the insulin is not something they feel that is a large resort. They should know that what is diabetes, what are the complications, and how to prevent it. And for that, I think the schools also should be educated about it. There should be some school education program about diabetes, blood pressure, coronary diseases, where the student as such comes to know about these common diseases. If I want to know about Babar, why not about cardiovascular disease that is going to affect my health?
Yes. So, what is your message regarding the diabetes?
My message is that eat in moderation, exercise in moderation, and fight out the disease if you have the diabetes by simple methods of good lifestyle.
So my another question is, people who are suffering from diabetes can go for another mode of a treatment along with the allopathic treatment if they are getting?
You see, the treatment is one that decreases blood sugar. Whether it's allopathic, whether it's Ayurvedic, whether it's homeopathic. Problem with is that none of other methodology of treatment or other pathies have been able to give us any scientific data how do they decrease. And for example, if they are off the drug, of the medicines, how much blood sugar or HbA1c decreases. So we just do not know. We are all in blind. Yes, they can go for lifestyle, and if somebody says that fenugreek seeds or methi decreases blood sugar, why not? You can take that, does not cause any harm. But any other of the tablet form of medicine, we are strict no, because we do not know what it contains and what amount it contains.
Okay. So my another question is, who are more prone to diabetic? Will it depend upon the age factor, or the sex, or the demography, or you say the lifestyle?
All. As the age advances, the chance of type 2 diabetes increases. Number 2, demographic definitely affects. As we discussed, Southeast Asian are much more prone to diabetes than the Western counterpart. Lifestyle, again, sex, male are more prone to diabetes than females.
Okay. Is there any solution to get rid from this diabetic problem? Either it's a type 1 or type 2?
If you are asking me, is there any cure of diabetes? No. Control of diabetes? Yes. Right now we do not have any cure of diabetes.
Okay. Do you believe that there is some technology advancement, or there is some increase in the science technology?
Oh yes, there are lot many in pipeline. If you ask me, artificial pancreas, stem cell transplantation, etc., etc. They are going artificial pancreas where IDDM patient will not be required to keep on getting taking insulin injections. Stem cell transplantation, monoclonal antibody injections, they are all in research. We might be getting results in 3 to 4 years from now, but whatever are the papers we are getting, they are encouraging.
Okay. My last question is, what are the eating habits one person should adopt? Either they have to take the light food, or it's a normal diet which we take.
We should adapt to one thing, is that we should always keep, as with the age advances, we should cut down on the calories, because then you do not require that much calories to eat for one, right? So as your age advances, you try to change. That's what I've seen in India. We do not change. At the young age, if I'm taking 4 chapatis and I'm exercising, working hard, and as I become 40, I still keep on taking that 4 chapatis that I do not require, because I become more sedentary. I'm not working that hard. So for me, the requirement has changed. So I should keep on changing my lifestyle, my eating habits. I should cut down more on carbohydrates as age advances. Start increasing more on proteins that builds up my muscle and decreases my fat intake. So that we should keep on changing.
Okay, sir. Thank you very much for this. Thank you.
Thank you.